Hello everyone, this is Dr. Wayne Smith at Family Chiropractic in Stettler. Have you been getting the cold shoulder a lot? Well, there's nothing I can do to help you. You've got to work on your own relationships with people with that one. But I do want to talk about something similarly named, and that is frozen shoulder. This is also called adhesive capsulitis. Now, to understand what this condition is, you need to be familiar with the anatomy of the shoulder joint a little bit. First of all, the shoulder joint is a shallow ball and socket joint. So you have your arm bone here, the humerus, with a ball on the end of it, and you have a shallow socket in your scapula, which connects the shoulder to the rest of your body. So there's a movement that occurs as this ball rolls in the socket. There's also a capsule of fibrous tissue that surrounds this joint, and inside there is something called synovial fluid, which is basically the lubricant to allow things to move around properly. In the condition known as frozen shoulder or adhesive capsulitis, the capsule starts to thicken and become inflamed, and that prevents the shoulder from moving in its proper range of motion. A person experiencing this will get progressively more painful in the area of the shoulder. It'll be increasingly difficult to move. And both ranges of motion, active range of motion and passive range of motion, are both affected. In other words, if I try to move my own shoulder, it becomes very difficult to do so. Also, when I'm relaxed and someone else, such as a practitioner, tries to raise my arm, that will also be restricted. So it's quite a complicated problem, and unfortunately there's not a lot really well known about exactly how it comes about. It usually happens in people between the ages of 40 and 60, more often with women than with men. Some factors that have been identified that may lead to more cases of adhesive capsulitis are things like diabetes and smoking and some other chronic diseases. But the link is not really quite understood. It doesn't seem to be related with repetitive motion. It doesn't seem to be related with what kind of job you have or whether you're using that arm more than the other arm. For example, if you're right-handed, that doesn't necessarily mean you're more likely to have right shoulder problems. But the thing with adhesive capsulitis, it can become a very painful condition, and it can last for months, even years. And it's quite difficult to treat. There's not a lot of evidence to support any one particular magical cure. But what is helpful is things like exercises. Sometimes anti-inflammatories are helpful. And I personally have had some anecdotal evidence in treating people with laser therapy. And the reason why laser therapy seems to work a little bit on this condition is because it helps to reduce the inflammation. So if we can get that capsule, the inflammation reduced in the capsule, it helps to start loosen things up. But unfortunately, frozen shoulder is quite a difficult condition to treat. Exercises can be quite helpful. If you are having problems with your shoulder, I invite you to come into the clinic. We'll check it out, see if it actually is frozen shoulder or if there's something else going on, and find out what we can do to help you get out of pain. I'm Dr. Wayne Smith from Family Chiropractic in Stettler. Thanks for watching.